Hello, this is Gabriela Sicocchio's Advanced GIS Fall 2018 final project on access to obstetrics care in Washington, D.C. So throughout history, our society has seen great advancements in medical care, specifically for women throughout their pregnancies. However, this project is trying to understand why we are seeing the opposite happening in our nation's capital, Washington, D.C. So in 2017 and 2018, two separate obstetrics care units in Washington, D.C. in two separate hospitals were closed. The United Medical Care Hospital's obstetrics care unit was closed due to dangerous conditions, while the Providence Hospital's unit was closed for financial reasons. Both of these are located in the southeast and northeastern quadrants of Washington, D.C., which we will see the significance of later on. So this project's main question was to understand what impact the closure of these hospitals would have on women in Washington, D.C., and to also try and understand what research shows and what geography shows about the level of maternal health care that women receive in DC. So the study area is shown here on this map. This is Washington, D.C., and we have about 7 hospitals. The black dots are those that are still running obstetrics care units, and the green ones are those that have closed. So you can see a great area is left without coverage. So I wanted to understand specifically what areas were within 10 and 20 minutes drives of the remaining obstetrics care units. Unfortunately, the OpenStreetMap data did not properly load in ArcGIS, so I was unsuccessful in creating a network analysis and was also unsuccessful in finding a publicly available network data set of Washington, D.C. While I found other cities, I was pretty set on this one and wanted to create a full picture. So I will show this shapefile I found online in ArcGIS. I did not create this, but it still shows the drive times of 10 minutes and gives a reference of about what it's like to drive across the city. It's much smaller than something like Los Angeles. So the purple is a 10-minute drive from various hospitals from 2015, and I circled the areas on that map that are no longer serving women, pregnant women, and you can see that they are very large areas of the city. And then this is a map that I created showing a 1-mile radii from the various 2015 obstetrics care units using OpenStreetMap data. So I was able to make the OpenStreetMap data get this far by loading the lines. However, when I tried to create a network data set, there was an error that read this: the row contains a bad value. And using my knowledge of ArcGIS and OpenStreetMap, I was unable to solve that. So what is significant about the closure of these hospitals is that they are located in an area of the city that is much lower income than the area of the city that remains covered by the open hospitals. So this is a spatial autocorrelation analysis using Lisa clusters from 2010 average household income from the Census Bureau. What this map is showing is that in the red high section of DC, census tracts of high income are surrounded by other census tracts of high income, and that in the blue section, low-income census tracts are surrounded by other low-income census tracts. So we can see a real clustering of different groups of people with different incomes throughout the city. The middle here in gray are those census tracts that are not significant in this analysis because they are census tracts surrounded by different average household incomes. Here's a map that shows the actual ranges. So we have a really great range of 400,000 about dollars. And again, you can see that the northwestern area of the city is much higher income than the southeastern. So moving on, I wanted to look at prenatal care percentages throughout the city, and I found some data that shows the 2008 and 2014 values. So in 2008, it's interesting to see that the average prenatal care percentages were actually pretty high all throughout the city, especially compared to the national average of about 71% of women receiving prenatal care. So here's the 2014 map, and it's interesting that there was a great decrease in every single ward of Washington, D.C. And at the same time, the national average increased from 71% to 76%. So I cannot explain why this happened. I can just show the data. But it is interesting to consider the fact that 4 years later, in 2018, one of the major obstetrics care units was shut down. So while that's not causation, there is correlation. And here is a map of the change in the percentages. So clearly in the southeastern low-income part of Washington, there was a really great decrease in prenatal care. While in the northwestern quadrant, while there was decrease, it was much, much less. So lastly, I wanted to look at low birth rate. Babies that are born weighing less than 2,500 grams are considered to have a low birth weight. And this can be dangerous for a number of reasons and requires really special care in the hospital. So here's a map of 2014. And again, we're seeing an inequality throughout the city. So the national average of babies with low birth rate is 8%, was 8% in 2014. And in the upper income parts of DC, women on average had low birth weights for their babies that was below the national average, while the opposite happened in Southeast. And then here I overlaid some income data from our census 2010 results, and this just verifies what I just said, with some room for error. In conclusion, the closure of these hospitals is a danger for Washington, D.C., especially since the areas that were left underserved are very low income and have already seen low birth weights and low levels of prenatal care in the past 20 years. Some limitations of this project are obvious. The network dataset did not work, and that's because of the OpenStreetMap data that I could not get to work. In the future, it would be very helpful if there was a higher quality OpenStreetMap dataset available, or a public network dataset for Washington, D.C. on their GIS data website, which I utilize pretty often. And just in terms of the findings of this project, Washington needs to be really attentive to the need of women looking forward because of the closure of these units, especially in the northeastern and southeastern quadrants of the city. Here are some of my sources, and thank you.